Welcome to our deep dive into aneurysmal subarachnoid hemorrhage, or aSAH for short.
Yeah, it's a rare type of stroke, but as you said, it can be incredibly
It
serious.
can. And we're going to break down some of the medical research that you've been kind enough to share with us and uncover what's most important for everyone to know about this. And, just thinking about aSAH, it affects about 6 out of every 100,000 people every year.
Yeah, so not super common, but the impact on those 6 people per 100,000 can be enormous.
Absolutely. And so what exactly is happening in the brain when someone has an aSAH?
Well, you have a weakened area in one of the blood vessels in the brain.
Mm-hmm.
That weakened area is called an aneurysm, and when it bursts, it ruptures.
Mm-hmm.
And then blood spills into the space around the brain, and that's the subarachnoid hemorrhage.
Okay, so imagine if you had a garden hose and there was a bulge in it that eventually bursts. That's similar to what happens with an aneurysm.
Yeah, that's a great way to think about it. And it's interesting because the overall number of aSAH cases has actually gone down. Yeah, thanks to fewer people smoking these days
Makes sense.
and better blood pressure control.
Yeah.
But it's still a major concern, particularly for women.
And, we've made all these advancements in how we treat things. And even with that, about 30% of those hospitalized with aSAH don't make it past 90 days.
Right. It really highlights the seriousness of aSAH and the long-term consequences for those that do survive, because
Yeah.
many people face long-term challenges like problems with their thinking and their memory, physical abilities, and it can really impact their quality of life and ability to work.
Absolutely.
Yeah.
So I think a good place to go from here is, what are some of the signs of aSAH? What should people be looking out for?
The hallmark symptom is a sudden and intensely painful headache.
Yeah.
It's often described as the worst headache of my life.
Mm-hmm.
And this is often referred to as a thunderclap headache.
Okay.
And this is the hallmark of aSAH.
Wow, that sounds terrifying.
Yeah.
What other symptoms might people experience?
You might experience nausea, vomiting problems with your vision, confusion, or even lose consciousness.
So if someone listening or someone around them is experiencing this kind of sudden severe headache, you don't want to hesitate. Seek medical attention immediately.
Absolutely.
Time is of the essence.
Early diagnosis is critical.
Yeah. And the research you've shared mentions things called severity scales, like the WFNS and the Hunt and Hess scales.
Right.
What are those?
So these scales help doctors categorize the severity of the aSAH based on your symptoms and what they see on the CT scan.
Okay.
So it's a standardized way to assess the situation and guide treatment decisions.
Okay. So once aSAH has been diagnosed, what happens next?
The top priority is preventing rebleeding.
Okay.
So you have to secure the ruptured aneurysm as quickly as possible, ideally within 72 hours.
Wow. So how do you actually secure an aneurysm?
So there are two main approaches. The first is surgical clipping, which involves a craniotomy, where they remove a portion of the skull to access the aneurysm. And then a tiny metal clip is placed on the neck of the aneurysm to stop the bleeding.
Wow. Like a little mini clothespin.
Yeah.
That's
right.
amazing.
Yeah.
And then what's the second approach?
The second approach is endovascular coiling, which is a minimally invasive technique. So a catheter is inserted into a blood vessel, usually in the groin,
Yeah.
and guided all the way up to the brain.
Wow.
Once it reaches the aneurysm, tiny platinum coils are released,
Okay.
which fill it up and block blood flow, preventing further bleeding.
So it's like you're plugging up a leaky faucet from the inside.
Right. Exactly.
That's fascinating. How do they decide which approach is the best to use?
Well, the choice depends on a lot of factors,
Yeah.
including the location and the size of the aneurysm
Okay.
and the patient's overall health.
Makes sense. Now, the research also mentioned a medication called tranexamic acid.
Yeah.
What is that used for with SS?
You know, tranexamic acid used to be thought of as something that was helpful in preventing rebleeding. But recent studies have shown that it doesn't really improve outcomes. And it may actually even increase the risk of complications.
Oh, wow.
So it's not used routinely anymore.
That's really interesting how medical practices evolve over time as research comes out.
Yeah, it's a constant learning process.
Absolutely. So now we've secured the aneurysm. What is the next big challenge with aSAH?
So then the focus shifts to managing the various complications that can arise.
Okay.
After ASA, one of the most serious is delayed cerebral ischemia, or DCI.
Okay, DCI.
Yeah.
What is that?
So after the initial bleed, the brain's blood vessels can suddenly constrict.
Okay.
And that leads to reduced blood flow, which essentially starves brain cells of oxygen and nutrients.
So it's like a secondary stroke. That happens days after the initial bleed.
Yeah, you could think of it that way.
Yeah.
Das DCI typically occurs between 4 and 14 days after ASA,
Wow.
and it affects about 30% of patients.
Wow. And what causes this to happen, these constrictions?
So we often see a narrowing of the larger blood vessels called angiographic vasospasm, but that's not the only cause.
Okay, so there's more to it.
There's more too. There are other factors at play, like the formation of tiny blood clots in smaller vessels called microthrombosis,
Okay.
and problems with the brain's ability to regulate blood flow, which is called impaired autoregulation.
So it's really complex with a lot of different contributing factors.
Yeah, absolutely.
So how do you go about preventing these constrictions from happening?
Well, one of the key preventive measures is a medication called nimodipine,
Okay.
and it helps relax and widen blood vessels, which promotes better blood flow to the brain.
Okay, so it's like a traffic controller for the brain's highways.
Yeah, a good analogy.
That's a great analogy. I like that. And in addition to the medication, is there anything else that can be done?
Yeah, maintaining a normal blood volume, which is called euvolemia, is also critical.
Okay.
You need enough blood flowing to keep the brain happy.
Like, makes sense.
Mm-hmm.
But even with all of these efforts to prevent it, sometimes it still happens.
Right.
So what happens if DCI does develop?
Well, close monitoring in the ICU is crucial. Yeah.
And doctors use various techniques like continuous EEG or CEEG and transcranial Doppler ultrasound or TCD to detect signs of DCI early on.
So it's all about being vigilant and catching it early.
Right, exactly.
Before it has a chance to cause damage.
If DCI is detected, the treatment focuses on improving blood flow to the affected areas of the brain.
Okay.
So that might involve things like induced hypertension, where medications are used to raise blood pressure and force more blood through those constricted vessels.
Wow.
Another option is endovascular rescue therapy, where catheters are used to deliver medications directly to the narrowed blood vessels.
Wow, that's incredible. So we've talked about the initial shock of the rupture, then we secure the aneurysm, and now we have this potentially devastating complication of DCI.
Right.
And I think it's clear that aSAH is incredibly multifaceted.
Absolutely. And we've really just scratched the surface.
Yeah.
There are other complications that can arise
Okay.
that affect both the brain and other organ systems. Well, it's a deep dive. So let's keep exploring what other complications can occur.
Let's talk about a condition called hydrocephalus,
Okay.
which literally means water on the brain.
So water on the brain,
What?
bring on the brain mysteries.
It's not actually water.
Okay.
It's a buildup of cerebrospinal fluid, or CSF. This fluid surrounds the brain and the spinal cord, cushioning and protecting them.
Okay, so how does this relate to aSAH?
So think about your kitchen sink. When there's a blockage, the water backs up
Right.
and can't drain properly.
Yeah.
That's similar to what happens in hydrocephalus.
Okay.
The blood from the ruptured aneurysm can block the normal flow of aSAH,
Oh.
leading to a buildup of pressure inside the skull.
So the brain is being squeezed by this excess fluid.
Exactly. And this pressure can cause a range of symptoms, from drowsiness and confusion to problems with eye movements, and in severe cases, even coma.
Wow. That sounds serious.
Yeah.
How is hydrocephalus treated?
The most common treatment is to insert a drain called an external ventricular drain, or EVD.
Okay. To remove the excess CSF and relieve the pressure.
Okay.
In some cases, a permanent shunt might be needed to continuously drain the fluid. So you're creating a detour for that backed up fluid.
Exactly. Now, alongside hydrocephalus, we also need to think about seizures,
Okay, seizures.
which is another potential complication after ASA.
So it's really not just a single event. It's like a whole cascade of potential problems.
You're absolutely right. The brain is a very complex organ.
Yeah.
And when it's injured, the effects can be far-reaching.
Okay, so what makes seizures a risk factor after ASA?
Well, the exact reasons are still being studied,
Okay.
but it's likely due to a combination of factors, including irritation and inflammation caused by the blood,
Okay.
changes in the brain's electrical activity, and possible damage to brain tissue.
So the brain's kind of in this hyperexcitable state,
Exactly.
making seizures more likely.
Right.
And how often do seizures happen after ASA?
Well, seizures can occur at various points,
Okay.
both during hospitalization and even months or years later.
Wow, that's concerning. What can be done to prevent or manage seizures if they do occur?
Well, current guidelines actually suggest that not everyone with aSAH needs to be on anti-seizure medications,
Okay.
but for those at higher risk, like those with severe bleeds or certain types of aneurysms,
Mm-hmm.
preventive medication might be
Just
considered.
a case-by-case basis.
Precisely.
Yeah.
And if seizures do occur, they need to be treated promptly with appropriate medications to
Uh-huh.
control them and prevent further brain injury. And we often use continuous EEG monitoring in the ICU to
Hmm.
detect even subtle seizures that might not be otherwise noticeable.
Yeah, so this constant monitoring,
Yeah.
it really underscores how crucial specialized care is for these patients.
Absolutely. So we've talked about hydrocephalus and seizures,
Yeah.
but before we move on to the systemic issues,
Right.
there's one more important thing to discuss that can happen within the skull,
Okay.
and that's intracranial pressure, or ICP.
Okay, ICP. This sounds like it could be a real pressure cooker for the brain.
You're not wrong.
Mm-hmm.
So intracranial pressure refers to the pressure inside the skull,
Mm-hmm.
and it's a delicate balance. The skull is a rigid container,
Right.
so any increase in the volume of its contents, whether it's brain tissue, blood, or CSF,
Yeah.
can cause the pressure to rise.
And aSAH really throws a wrench in that system.
Yeah, it does. The blood from the ruptured aneurysm takes up space.
Right.
As we discussed, hydrocephalus and swelling of the brain tissue can further increase the pressure inside the skull.
So high ICP is a very dangerous situation for the brain.
It can be very serious.
Yeah.
Elevated ICP can restrict blood flow to the brain, leading to further damage.
Oh, wow.
It can even cause parts of the brain to shift or herniate, which is a life-threatening complication.
How do doctors monitor and manage ICP in these patients?
So in some cases, especially for patients with severe bleeds or neurological decline,
Mm-hmm.
doctors might insert a device to directly measure the pressure inside the skull.
Okay.
This is often done using a ventricular catheter, which we mentioned earlier.
Right.
Can also be used to drain excess CSF. It's like a multi-purpose tool.
Indeed.
Mm-hmm.
Now, if ICP is elevated, the treatment focuses on reducing that pressure.
Okay.
This might involve various strategies, from draining CSF to administering medications to reduce brain swelling, and in severe cases, even surgery.
Wow. It's all about keeping that pressure under control
Exactly.
to protect the brain from further harm.
You need to restore that delicate balance within the skull as much as possible.
Absolutely. So we've talked about hydrocephalus seizures and now elevated ICP.
Right.
But aSAH doesn't just affect the brain directly. There are all these other systemic complications to consider as well.
That's right. Aneurysmal subarachnoid hemorrhage can have these wide-ranging effects on the body,
Yeah.
impacting everything from the heart and lungs to the kidneys and hormones.
Yeah.
These systemic complications can be just as serious as the brain-related ones.
Yeah, this is really painting a picture of how complex aSAH is.
It is. And treating it effectively requires a multidisciplinary team of specialists working together to address all of these challenges.
Mm-hmm.
Let's start diving into some of these systemic complications then.
Okay.
Starting with the heart. What kind of heart problems can ASA trigger?
Aneurysmal subarachnoid hemorrhage can disrupt the heart's rhythm, leading to arrhythmias,
Okay.
which are irregular heartbeats.
And why would a bleed in the brain affect the heart's rhythm?
Well, it might seem counterintuitive, but the brain and the heart are very closely connected.
Okay.
So that surge of adrenaline and stress hormones that happens after ASA
Right.
can disrupt the heart's electrical system, leading to those abnormal rhythms.
So it's like the heart is caught up in the brain's emergency response.
Yeah, in a way, yes. And these arrhythmias can range from mild to life-threatening.
Oh, wow.
So close monitoring with electrocardiograms or ECGs is crucial.
Absolutely. Are there any other heart-related complications besides arrhythmias?
Yes. Unfortunately, ASA can also weaken the heart muscle, leading to what's called myocardial dysfunction.
Okay.
This means that the heart isn't pumping as effectively as it should,
Hmm.
and in severe cases, it can lead to heart failure.
So not only is the brain at risk,
Yeah.
but the heart's ability to function as well.
Right. The heart's working overtime trying to maintain blood flow to the brain and other vital organs.
Right.
And sometimes it just can't keep up. In rare cases, aSAH can even trigger Takotsubo cardiomyopathy,
Oh, yeah.
also known as broken heart syndrome.
Broken heart syndrome, I've heard of that. Isn't that usually associated with emotional stress?
Yeah, you're right. It often is.
Mhm.
But it can also be triggered by severe physical stress.
Oh.
Like what's caused by aSAH Takotsubo cardiomyopathy is characterized by a temporary weakening of the heart muscle,
Mm-hmm.
and it causes symptoms that mimic a heart attack,
Wow.
like chest pain and shortness of breath.
That's incredible. So the
Uh-huh.
brain's distress is manifesting in all these unexpected ways.
Yeah, the body is a remarkable and complex system.
It is. Now, beyond the heart, we also need to talk about the lungs.
Right.
And the lungs are another major organ system that can be impacted by ASAs.
Yeah, they are. They're actually particularly vulnerable. Aneurysmal subarachnoid hemorrhage can increase the risk of various pulmonary complications, from pneumonia to a dangerous condition called neurogenic pulmonary edema, or NPE.
I'm sensing a pattern here. It seems like aSAH has this domino effect on the whole body.
You're exactly right. And let's start with pneumonia.
Okay.
Why are aSAH patients more susceptible?
Yeah, why is that?
Well, there are a couple of reasons. First, aSAH can impair the brain's ability to control swallowing, making it easier for food or liquids to go down the wrong pipe and into the lungs.
Right.
This can lead to aspiration pneumonia.
So the brain injury is affecting these really basic functions.
Exactly. And second, patients with ASA often require mechanical ventilation to help them breathe.
Okay.
And unfortunately, that carries its own risk of developing ventilator-associated pneumonia.
So it's like a double whammy for the lungs.
Right. Now let's talk about neurogenic pulmonary edema, or NPE.
Okay, NPE.
This is a more serious complication
that
involves a sudden buildup of fluid in the lungs, making it difficult to breathe.
That sounds terrifying. What causes that?
So it's thought to be triggered by that massive surge of adrenaline and other stress hormones that are released after ASA.
Right.
These hormones can cause blood vessels in the lungs to constrict, leading to increased pressure and fluid leakage into the air sacs.
So like those heart problems we talked about, it's like the body's own stress response ends up causing harm.
Exactly. And in severe cases, NPE can progress to a condition called acute respiratory distress syndrome, or ARDS.
Okay.
Which is a life-threatening form of lung failure.
This is all getting a bit heavy. Is there any good news when it comes to these lung complications after ASA?
While there is some encouraging data, the research points out that the incidence of ARDS after aSAH has actually decreased in recent years.
Oh, that's good.
Yeah, it's likely due to improvements in aSAH care and better management of ARDS.
So with proper care, some of these things can be prevented or at least mitigated.
Absolutely. And that brings us to the next crucial aspect of aSAH care, which is metabolic and fluid management.
Okay, this sounds a little less dramatic than heart and lung failure.
Right.
But I'm guessing it's still really important.
Yeah, you're right. It might not be as flashy, but it's absolutely fundamental to the patient's recovery.
Okay.
So metabolic and fluid management is all about ensuring that the body has the right balance of fluids, electrolytes, and nutrients to support healing and prevent further complications.
So you're fine-tuning the body's internal environment.
Perfect analogy.
Okay, good.
So this involves careful monitoring of the patient's fluid intake and output, blood pressure, electrolytes, which are minerals like sodium, potassium, and magnesium that are crucial for nerve and muscle function.
Right. It sounds like a constant juggling act to keep everything in balance.
It is, and it often requires adjustments to medications, intravenous fluids, and even the patient's diet.
Are there any specific challenges when it comes to fluid management in aSAH patients?
One of the key concerns is a condition called hyponatremia, which is low sodium levels in the blood. And it's quite common after ASA and can have a significant impact on brain function.
And why does this happen, this hyponatremia?
Well, there are a few possible culprits. One is a hormonal imbalance that causes the body to retain too much water, diluting the sodium in the blood. Another is cerebral salt wasting, where the brain itself starts excreting sodium.
So the brain is either hoarding water or flushing out salt.
Precisely.
And both lead to low sodium levels.
Yes. And treating hyponatremia can be tricky.
Yeah.
It requires a delicate balance of fluid restriction, sodium supplementation, and sometimes even medications.
So we've covered heart problems, lung complications, and the importance of maintaining this metabolic and fluid balance.
Right.
What other systemic concerns are there?
Another common issue after SAH is fever.
Fever? Yeah. Okay, that seems like a pretty generic symptom. Is it really a big deal?
Yeah, you'd be surprised. Fever after aSAH can actually be a sign of a more serious underlying problem, like an infection.
Oh.
And it's been linked to worse outcomes.
So it's not just a simple fever?
No. Doctors need to figure out what's causing the fever and treat it accordingly.
Right.
That might involve things like antibiotics for infections, cooling measures to bring the temperature down, and addressing any other contributing factors.
So again, aSAH demands this really holistic approach.
Yeah.
Looking at the whole body.
Precisely.
Yeah.
And to round out our discussion of systemic complications, we also need to touch on deep vein thrombosis, or DVT.
DVT, yeah, those are blood clots in the legs.
Right.
That's right.
And aSAH increases the risk of developing DVT for a couple of reasons.
Oh.
First, aSAH itself can trigger changes in blood clotting, making clots more likely to form.
Right.
And second, patients with aSAH often have limited mobility, which also contributes to DVT risk.
So physiological changes and lifestyle factors all playing a part.
Exactly. And DVT can be serious because those clots can break free and travel to the lungs, causing a pulmonary embolism.
Which can be fatal. Yeah. So to prevent DVT, doctors typically prescribe blood thinners and encourage patients to move their legs as much as possible, even if they're bedridden.
So it's medication and movement.
Exactly. Now that covers the major systemic complications we wanted to highlight. Heart problems, lung issues, metabolic and fluid imbalances, fever, and DVT.
It's a lot to take in.
It is.
I feel like I need a medical degree to follow along.
But it really underscores how complex and demanding aSAH care can be.
Absolutely. Now, speaking of outcomes, that's where we need to go next in our deep dive.
Okay.
Let's talk about what the long-term outlook is for people who survive aSAH.
Okay.
I'm cautiously optimistic after learning about all these potential complications. But I'm hoping for some good news.
Well, there is good news. The research tells us that long-term outcomes for aSAH patients have significantly improved over the years.
Oh, good.
Thanks to advancements in treatment and care.
That's a relief to hear.
I didn't know.
But I imagine there's still a wide range of possible outcomes. Absolutely. You know, the severity of the initial bleed, the presence of complications, individual factors like age and overall health all play a role in shaping a person's recovery journey.
And what are some of the common challenges that aSAH survivors face in the long term?
So cognitive challenges are a major concern. A lot of survivors experience problems with memory, attention, and executive function, which can make it difficult to return to work or even manage daily activities.
So even if they recover physically, there can be these lingering effects on the brain.
That's right. And these cognitive difficulties can be incredibly frustrating and isolating for survivors.
Yeah, absolutely. What about physical limitations?
So physical disabilities can also occur depending on the extent of the brain damage caused by the aSAH. Some survivors might experience weakness paralysis or problems with coordination and balance.
So it's a spectrum.
It is.
Potential challenges, both mental and physical, that need to be addressed.
And that's where rehabilitation plays a crucial role.
Rehabilitation. Tell us more about that.
So rehabilitation after aSAH is a comprehensive program that aims to help survivors regain as much function and independence as possible.
And what does that involve? What does rehab look like?
It can include a variety of therapies, depending on the individual's needs. Physical therapy focuses on improving strength, mobility, and balance. Occupational therapy helps people relearn everyday skills like dressing, bathing, and cooking. Speech therapy addresses problems with communication and swallowing. And cognitive rehabilitation focuses on improving memory, attention, and problem-solving skills.
So it's really a holistic approach to recovery, supporting people on multiple levels.
It is. And alongside these formal therapies, ongoing support for psychological well-being is also essential.
That makes sense. This is such a life-altering event.
Absolutely.
I can imagine it takes a toll on mental health.
Many survivors experience anxiety, depression, and even post-traumatic stress disorder.
Wow. So it's not just about fixing the physical damage. But also addressing the emotional and psychological impact.
Exactly. Aneurysmal subarachnoid hemorrhage is a life-changing experience. And recovery is a long-term process that requires a combination of medical care, rehabilitation, and emotional support.
We've covered a lot of ground already in part 1 of our deep dive into ACS.
We have.
From the initial shock of that rupture to securing the aneurysm, and now this potentially devastating complication of DCI. And it's clear that this is a very multifaceted condition.
Absolutely. And we've just scratched the surface. There are other complications that can arise, both inside the skull and affecting other organ systems.
Well, this is a deep dive, so let's keep exploring. What's next on our list of aSAH complications?
Next, we'll delve into a condition called hydrocephalus.
Okay, hydrocephalus. Bring on the brain mysteries.
It literally means water on the brain.
Water on the brain. But it's not actually water. It's a buildup of cerebrospinal fluid, or CSF.
This fluid surrounds the brain and spinal cord, cushioning and protecting them.
Okay, so how does this relate to aSAH?
So imagine your kitchen sink.
Go.
When there's a blockage, the water backs up and can't drain properly. That's similar to what happens in hydrocephalus. The blood from the ruptured aneurysm can block the normal flow of CSF,
Ah.
leading to a buildup of pressure inside the skull.
So the brain is getting squeezed by this excess fluid.
Exactly. And this pressure can cause a range of symptoms, from drowsiness and confusion to problems with eye movements, and in severe cases, even coma.
That sounds serious. How is hydrocephalus treated?
The most common treatment is to insert a drain called an external ventricular drain, or EVD,
Okay.
to remove the excess CSF and relieve the pressure.
Right.
In some cases, a permanent shunt might be needed to continuously drain the fluid.
So you're creating a detour for that backed up fluid.
You could say that. Now, alongside hydrocephalus,
Okay.
we also need to discuss seizures.
Okay, seizures. This is really highlighting how aSAH is not just a single event,
You're absolutely right.
but this cascade of potential problems.
The brain is a complex organ, and when it's injured, the ripple effects can be far-reaching.
Okay. Why are seizures a risk after aSAH?
The exact reasons are still being studied, but it's likely due to a combination of factors, including irritation and inflammation caused by the blood from the ruptured aneurysm,
Okay.
changes in the brain's electrical activity, and possible damage to brain tissue.
So the brain is basically in this hyperexcitable state,
Exactly.
making seizures more likely.
Right.
How common are seizures after AC?
So seizures can occur at various points, both during hospitalization and even months or years later.
That's concerning. What can be done to prevent or manage seizures in these cases?
Current guidelines suggest that not everyone with aSAH needs to be on anti-seizure medications.
Okay.
However, for those at higher risk, like those with severe bleeds or certain types of aneurysms, preventive medication might be considered.
So it's a case-by-case decision.
Precisely. And if seizures do occur, they need to be treated promptly with appropriate medications to control them and prevent further brain injury. Continuous EEG monitoring is often used in the ICU to detect even subtle seizures that might not be otherwise noticeable.
So the monitoring never stops. It really underscores how crucial specialized neurocritical care is for these patients.
Absolutely. We've covered hydrocephalus and seizures, but before we move on to systemic issues, there's one more important intracranial concern.
Okay.
Intracranial pressure, or ICP.
Okay, ICP. This sounds like it could be a real pressure cooker for the brain.
You're not wrong. Intracranial pressure refers to the pressure inside the skull. It's a delicate balance. The skull is a rigid container, so any increase in the volume of its contents, whether it's brain tissue, blood, or CSF,
Yeah.
can cause the pressure to rise.
And aSAH throws a wrench into that system.
It certainly does. The blood from the ruptured aneurysm takes up space, and as we discussed, hydrocephalus and swelling of the brain tissue can further increase the pressure inside the skull.
So high ICP is a dangerous situation for the brain.
It can be very serious. Elevated ICP can restrict blood flow to the brain, leading to further damage.
Right.
It can even cause parts of the brain to shift or herniate, which is a life-threatening complication.
How do doctors monitor and manage ICP in aSAH patients?
In some cases, especially for patients with severe bleeds or neurological decline, doctors might insert a device to directly measure the pressure inside the skull.
Okay.
This is often done using a ventricular catheter, which, as we mentioned earlier, can also be used to drain excess CSF.
It's like a multi-purpose tool for monitoring and treatment.
Indeed. Now, if ICP is elevated, the treatment focuses on reducing the pressure. This might involve various strategies from draining CSF to administering medications to reduce brain swelling, and in severe cases, even surgery.
So it's all about keeping that pressure in check to protect the brain from further harm.
Exactly. The delicate balance within the skull needs to be restored as much as possible.
We've discussed hydrocephalus seizures and now elevated ICP. But aSAH doesn't just affect the brain directly, right? There are systemic complications.
Welcome back to our deep dive into aneurysmal subarachnoid hemorrhage.
In part one, we talked about what aSAH, the risks involved, how it's diagnosed, and those immediate steps that are taken to treat it. We also went into some of those serious complications that can happen.
Yeah, we covered a lot. But now I think in part two, it's important to kind of shift gears and talk about the long-term impacts of this condition, the challenges that survivors often face, and the research that's giving us hope for better outcomes.
Yeah, that sounds like a great plan. So let's start by revisiting those long-term outcomes. And, we mentioned that outcomes for aSAH have improved over the years, but that everyone's experience is unique.
That's a crucial point. The traditional ways of measuring recovery, like just seeing if someone can walk or talk or do basic daily tasks, often miss a really big piece of the puzzle. They don't always capture the unseen struggles that many survivors experience.
What do you mean by unseen struggles?
Cognitive challenges, for example. Many aSAH survivors have trouble with things like, Memory, attention, planning, and processing information. These are the mental skills that we need to function effectively in everyday life.
So even if someone looks physically recovered, they might be grappling with these hidden difficulties.
Precisely. And it can be incredibly frustrating. Imagine trying to work, maintain relationships, or simply just enjoy life when your mental filing system is all jumbled, your to-do list keeps disappearing, and you can't seem to focus.
That sounds incredibly challenging, and not only for the individual, but I'm sure for their loved ones as well.
It is, and these cognitive challenges are often compounded by another common issue after aSAH.
Persistent fatigue.
Fatigue. Why would a brain bleed cause, ongoing tiredness?
The exact reasons aren't fully understood yet, but it's likely a combination of factors. The brain is working hard to heal, sleep patterns can be disrupted, and there might be hormonal imbalances at play. It's like the body is constantly running a marathon even when the person is trying to rest. So we're talking about this cluster of challenges: cognitive impairments, emotional distress, and persistent fatigue. And all of these can significantly impact a person's life even years after the ASA.
That's right. And because these struggles are often invisible, it can be really hard for others to understand what the survivor's going through.
It's like they're carrying this hidden burden that others can't see.
Exactly. Which is why it's so important to raise awareness about the long-term impacts of aSAH and advocate for more comprehensive and patient-centered care.
We briefly discussed rehabilitation earlier, but I think it's worth diving a little deeper. What exactly does rehabilitation entail, and how can it help survivors address these long-term challenges?
Rehabilitation after aSAH is a team effort. It usually involves a variety of specialists: physical therapists, occupational therapists, speech therapists, doctors, nurses, social workers, and more. And they all work together to create a personalized plan based on the individual's needs and goals.
So it's like a customized roadmap for recovery.
That's a great way to put it. And importantly, rehabilitation can start very early, even while the person is still in the ICU.
I always thought of rehab as something that happened after the acute phase of treatment, once the person was more stable.
We used to think that way. But we've learned that the brain is most adaptable in the early stages after injury. So the sooner we start working on those connections and pathways, the better the chances of maximizing recovery.
That makes sense. So what might early rehabilitation involve?
It could be as simple as helping the person sit up in bed, move their limbs, or communicate their needs. These seemingly small steps can lay the foundation for more progress later on.
As the person gets stronger, the rehabilitation program expands to include more intensive therapies, right?
Exactly. We talked about physical, occupational, and speech therapies in part 1. Just to recap, physical therapy focuses on improving strength, mobility, balance, and coordination. Occupational therapy helps people regain the skills they need for daily life, like dressing, bathing, cooking, or managing their finances. And speech therapy addresses problems with communication, swallowing, and the cognitive aspects of language.
It's fascinating how these therapies address such a wide range of needs, from basic physical function to complex cognitive skills.
And in addition to these core therapies, many rehab programs also offer specialized services like cognitive rehabilitation and psychological counseling.
Cognitive rehabilitation sounds interesting. What does that involve?
It's essentially about retraining the brain to compensate for those cognitive deficits we talked about earlier.
How do you retrain the brain?
There are many different techniques, depending on the specific challenges the person is facing. For example, if someone is having trouble with memory, therapists might teach them strategies like using calendars, reminder apps, and memory aids. If attention is an issue, they might use exercises that train focus and concentration. And for executive function impairments, they might work on skills like planning, organization, and problem solving.
So it's like providing the brain with new tools and strategies to work around those glitches.
That's a good way to put it. And an important part of cognitive rehabilitation is also about helping people become more aware of their strengths and limitations so they can develop coping mechanisms and advocate for themselves.
It sounds like empowerment is a key element of this process.
Absolutely. And that's where psychological counseling comes in as well. Aneurysmal subarachnoid hemorrhage is a traumatic event, both physically and emotionally. And many survivors benefit from professional support to process what they've been through, manage their emotions, and develop coping skills for moving forward.
So it's about addressing the emotional and psychological scars that aSAH can leave behind.
Precisely. Psychological counseling can also help survivors address the social and relationship challenges that often arise from cognitive impairments and fatigue. It's about providing a safe space to explore those feelings and develop strategies for communicating their needs and building healthy relationships.
It's clear that rehabilitation is a multifaceted process that goes far beyond just physical recovery. It's about supporting the whole person, their physical needs, their cognitive function, their emotional well-being, and their social connections.
That's a great summary. And while rehabilitation plays a vital role in helping survivors adapt and thrive, there's another piece of the puzzle that's constantly evolving: research.
Research. Tell me more about what's happening in the world of aSAH research.
Researchers around the world are working tirelessly to better understand aSAH, develop more effective treatments, prevent complications, and ultimately find a cure.
A cure for aSAH. Is that even a possibility?
It might seem like a distant goal, but researchers are making significant strides in understanding what causes aneurysms to form and how to prevent them from rupturing.
That would be incredible. What are some of the most promising avenues of research in aSAH prevention?
One exciting area is genetic research. Scientists are identifying specific genes that increase the risk of developing aneurysms.
So it's like a personalized risk assessment based on your genes.
Exactly. This knowledge could lead to earlier detection and preventive strategies. For people with a high genetic risk, closer monitoring or lifestyle modifications might help reduce their chances of developing an aneurysm.
That's fascinating. What about other approaches to prevention?
Another area of focus is the role of inflammation in aneurysm formation. Researchers are exploring whether anti-inflammatory medications or lifestyle changes that reduce inflammation could potentially lower the risk of aneurysms developing in the first place.
So it's about getting to the root of the problem, not just treating the consequences.
Precisely. Prevention is always the best medicine. But we also have to acknowledge that even with these preventive efforts, some people will still develop aneurysms. So research is also focused on improving treatments for those who experience a rupture.
Can you give us a glimpse into what's happening on the treatment front?
Researchers are constantly refining surgical and endovascular techniques to make them safer, more effective, and less invasive.
Can you give us some specific examples?
In surgical clipping, we're seeing advancements in microsurgical techniques, robotic-assisted surgery, and the development of innovative clips that are easier to place and more effective at sealing off aneurysms.
It's amazing how technology is changing the face of brain surgery.
And in endovascular treatment, we're seeing new types of coils, stents, and flow diverters that allow for more precise and controlled blocking of blood flow to the aneurysm.
It sounds like there's a lot of innovation happening in both approaches.
And that innovation extends beyond just treating the aneurysm itself. Researchers are also working hard to develop better treatments for the complications of aSAH, like DCI.
That's great to hear. We talked about how devastating DCI can be. Are there any new breakthroughs on the horizon for treating this complication?
There are several exciting areas of research, from medications that target specific pathways involved in vasospasm to novel therapies like stem cell transplantation.
Stem cell transplantation for aSAH. That sounds futuristic.
It's definitely cutting edge. The idea is that stem cells could potentially help repair damaged brain tissue and promote healing after aSAH. It's still early days, but the potential is enormous.
It's incredible to think about the possibilities. And it's not just about high-tech treatments, right? You mentioned earlier that lifestyle interventions are also being explored.
That's right. Researchers are increasingly recognizing that a holistic approach to recovery is essential. They're studying how factors like diet, exercise, stress management, and social support can impact cognitive function, fatigue levels, and overall quality of life for aSAH survivors.
So it's about empowering survivors to take an active role in their own recovery.
Exactly, and the early findings are promising. They suggest that simple lifestyle changes can make a big difference in how people feel and function after aSAH.
It's inspiring to see all the effort and ingenuity that's being poured into improving the lives of those affected by aSAH.
It truly is. And with each new discovery, we're getting closer to a future where aSAH is no longer such a devastating diagnosis.
Part 2 of our deep dive has been both insightful and encouraging. We've explored the long-term challenges of aSAH, the complexities of rehabilitation, and the exciting world of research. But there's one more crucial aspect we need to discuss before wrapping up: the societal and personal impact of this condition.
You're right. We focused on the medical and scientific aspects, but it's equally important to understand the human side of aSAH and its ripple effects on individuals, families, and communities.
That's a perfect segue into Part 3, where we'll explore those broader implications and tie everything together. Stay tuned. Welcome back to the final part of our deep dive into aneurysmal subarachnoid hemorrhage,
It's been quite a journey, hasn't it? Exploring this really complex condition, from that initial rupture to the long road to recovery and, that ongoing quest for better treatments.
Yeah, we've learned so much about the brain, the body's responses to aSAH, and the incredible resilience of the human spirit. But in this final part, I think it's important to kind of step back and look at the bigger picture. How does aSAH affect not just individuals, but also their families and society as a whole?
Those are great questions. And I think one of the most important takeaways from everything we've talked about is the crucial role of awareness.
Awareness in what sense?
Well, awareness is essential on multiple levels. For individuals, it's about knowing the signs of aSAH, recognizing that sudden severe headache as a potential red flag,
Hmm.
and seeking immediate medical attention if it strikes.
That thunderclap headache we talked about, it's not something to ignore.
Absolutely. Early diagnosis and treatment can make a huge difference in how someone recovers. But awareness is also vital for healthcare professionals, too. They need to be really vigilant in recognizing the signs of complications like DCI
Right.
and responding quickly and effectively.
So awareness within the medical community.
Yeah.
But I think you're also getting at something broader, right?
Yeah, we need to raise awareness about aSAH among the general public as well. There's still this misconception that aSAH is just a sudden event with a quick recovery period. And that's just not the case.
It's about understanding that this is a journey,
Yeah.
and often a very long and challenging one. And, with both visible and invisible struggles. And it requires a lot of ongoing support and understanding.
Exactly. And that support needs to extend beyond the survivor themselves. Families and caregivers play an absolutely crucial role in this whole recovery process.
Yeah, they're the unsung heroes. They provide that practical and emotional support day in and day out through all the ups and downs.
Absolutely. And they need support too. They need access to information resources and a sense of community to help them, navigate the challenges of caring for a loved one with aSAH.
So awareness isn't just about recognizing the signs of ASA. It's also about creating a network of support that encompasses individuals, families, healthcare providers, and society as a whole.
That's a great way to put it. It's about fostering a culture of empathy, understanding, and proactive care for those affected by this condition.
Another theme that has really stuck with me throughout all this is the power of resilience.
Resilience is truly remarkable. We've talked about some of the incredible challenges that aSAH survivors face. The cognitive impairments, the fatigue, the emotional toll. Yet we've also seen how individuals can adapt, find new ways to cope, and even discover new strengths and perspectives.
Yeah, they've shown us that even in the face of profound loss and change, the human spirit can find a way to not just survive, but thrive.
And those stories of resilience are so inspiring. They remind us that even in the darkest of times, hope is never lost.
And that hope is fueled by the ongoing research and innovation that we talked about in part 2, advancements in surgical techniques, the development of new medications and therapies, the exploration of stem cell transplantation, the focus on lifestyle interventions. It's all incredibly encouraging.
It really is. It's a testament to the dedication and ingenuity of researchers and clinicians around the world, who are committed to improving the lives of aSAH survivors and their families.
And ultimately, that's what this deep dive has been all about, expanding our understanding of aSAH, acknowledging the challenges, celebrating that resilience, and embracing the hope that comes with scientific progress and compassionate care.
We've covered so much ground, from the intricacies of the brain to the complexities of recovery, and the promise of future research. But as we wrap up, I just want to emphasize that this is really just the beginning of your journey into the world of ASA.
Yeah, that's right. We've provided a foundation, but we encourage you to continue learning, asking questions, and connecting with others who are on this path.
There are some incredible resources available out there. Support groups, online communities, advocacy organizations, all dedicated to empowering aSAH survivors and their families.
And we'll be sure to include links to some of those resources in the show notes.
This deep dive has been both challenging and inspiring. We delved into the depths of aSAH, but we also emerged with a greater appreciation for the strength of the human spirit and the transformative power of knowledge and compassion.
Thank you for joining us on this journey. Stay curious, stay informed, and most importantly, stay hopeful.